Hi, I'm Lisa Gallitz, Chair of Orthopedic Surgery at Mount Sinai Health System in New York City. For many of us, our kids have been inside after the cancellation of school sports programs and many other league sports programs. But spring is here and summer is coming, and it's time to get our kids back in action. We've gathered together some of our experts in pediatric musculoskeletal care to give some advice and helpful tips on getting our kids moving again. We hope you enjoy this webinar, and we're here for your entire family at Mount Sinai Orthopedics.
Hi, I'm Dr. Abby Allen, and I am the Chief of Pediatric Orthopedic Surgery at Mount Sinai Hospital in New York, New York. I am here to talk to you about how to get your younger children to be more active, especially during these times. One of the first tips I would give is, for one, just get outside. I didn't want to even do this video in a stuffy office. I wanted to come outside because one of the first things to do when you're getting your kids active is to just start that activity and get outside. So that is tip number one. Another tip is to add some routine or structure into your life. I think kids thrive on structure, especially the younger ones. They thrive with boundaries. So the more routine and structure that you have in your family, the more likely they're going to do it and feel safe. As an example, in our family, we have a morning warm-up that's through my older daughter's school, and the younger one does it with her. Your family, it might be bike rides, it might be family walks, it could be a dog walk, but add some structure to your daily routine. Another tip I have is to practice what you preach. If they see you being active, then they will be active too. So as an example today, I actually did an online workout video myself, and my 4-year-old actually joined in with me. It was only 4 minutes, but if they see you doing it, then they'll want to do it too. Another tip, and something that we do as a family, is to earn screen time, in an attempt to get them off the screen time, as the American Academy of Pediatrics actually only recommends a max of 2 hours outside of their school screen time. We have them earn that, and one of the ways they do that is through doing household chores, such as vacuuming, cleaning the room, or making their bed. Another tip I have is to just simply go old school. Nowadays, you're probably not involved in these activities with 12 other toddlers doing a very organized activity. So get a little disorganized. Go outside and do the games that you played when you were a child. For example, tag, catch the flag, wiffle ball, dodgeball, you name it. Just go outside if the weather allows and play it. If it doesn't allow, or you are willing to embrace the new, then one of my final tips would be to do that, and to maybe do some online videos, online dance classes with your kids, or even participating in a TikTok with them. You will be surprised at how much fun you have. So those are my tips to get outside, and I want you to all be well and be safe and have a great day.
Hi, my name is Brad Parsons. I'm a professor and vice chair of the Department of Orthopedics at Mount Sinai Medical Center. And today we're going to talk a little bit about how to keep your teenagers active and getting some exercise during the pandemic. And then we'll also discuss a little bit later, if you think your child's gotten injured, how to assess it at home, see if you need to bring them in to get them checked, or if it's something you think you might be able to manage if it's just a mild sprain or strain. So if you have teenagers like I do, I have 2 teenage girls, getting them to exercise can be a bit of a challenge. And when you're stuck in the house for 40 some odd days, it's always not so easy to get them outside doing stuff. We have a little bit of luck in our family. We have 2 daughters, one of whom is a soccer player and the other is a gymnastics athlete. And so we're lucky that their teams have asked them to do almost daily online or Zoom-based workouts. And so if your child's an athlete and is on a team, perhaps you're already doing this, which makes it a little easier. For those of you who don't have a child who's on a team or doing athletic sports during the springtime season, there's obviously a lot of options for you. We've gotten our girls to go out and go for runs, which as the weather is getting nicer is a nice way to get some exercise. They've actually done it with each other, and they've done it with a friend with a mask and social distancing. And so that's something that can be done whether you live in the city or out in the suburbs like us. If you have access to bike trails and biking, that's another thing our children have done. Obviously, we want them to wear a helmet. And again, they should practice their social distancing and wear a mask. But it's a nice way for them to get some fresh air and outdoor exercise. For those of you who don't have access to those outside activities, perhaps you live in the city or with the weather like it was in April not being so nice, it's nice to have some indoor things that your teenager can do. And so one is the online resources like the Zoom type team workouts that I described. But even if your child's not on a team sport or doesn't have that sort of resource, there's lots of options available to you online. There are apps that you can download on your phone or your child's phone to encourage them to have a variety of workouts. One app that we use in our family is something called 7, which is a 7-minute workout, and it can be focused on different parts of the body. It can be a whole body workout. It can be cardio. It can be strength training and other things. And you can do it all based in your home without any weights or any fancy equipment. So it's really a nice, easy workout that you can use. Other options that my younger daughter has used is going on YouTube and looking at some online videos and different workout routines that an online trainer is doing. And again, these are free, and so you can try those, or your child can try those on their own. And so even if you don't have access to outdoor activities, there's lots of options that I think you can have your teenage kid do. And really the hard part is getting them motivated sometimes to do this. They're not doing their normal routine, and so encouraging them to get some exercise every day is important. My wife and I both try to get our kids to do that, and now that the weather's gotten nicer and they're starting to run and doing things outside, I think it's really helped everybody's sort of morale and happiness to be able to do that. If your child has access to a bike and you have a teenage daughter like I do who also is a driver, what I would tell you is please don't have your younger child leave the bike in the middle of the driveway so your older daughter can drive over it. This is what happens when that occurs, and you can see that unfortunately our bike is no longer functional. So just make sure your kids are taking care of their equipment. If they're going to bike, have them wear a helmet. Please make sure that they're doing their social distancing as best as possible. And if they can't do that, and when they're exercising outside, they should always have a mask on and available so that when they get close to people, they can maintain that degree of safety. And so I think, with just a simple bit of effort on your part and trying to get your kids motivated, encourage them to do it maybe with a friend or with each other if they have siblings, or even with you if they're the kind of teenage kid who actually likes to hang out with their parents, then you might be lucky to be able to get your kids to do some of these things with you and make it more of a family exercise. So hopefully these quick little thoughts are helpful. The Department of Orthopedics is always available if there's anything that we can help you with at Mount Sinai. And so we look forward to when the pandemic is cleared up and we're getting back to normal, and hope everybody is safe and healthy and we all get through this together.
Hello everyone, my name is Dr. Nirvana, and I'm a pediatric orthopedist here at Mount Sinai. I have been tasked with talking a little bit about strength, conditioning, and warm-up in the pediatric athlete, especially in the context of shelter at home, and also our return back to sports, which will hopefully come sooner rather than later. And so for the last 7 weeks, we've all had to adjust to a new normal. As parents, it's been hard to see our kids confined to computer screens all day. And for our kids, the shift from a rich social life to the life of social distancing has been, tougher both mentally and physically. The loss of athletics has both a mental and physical toll, as the mental and physical benefits of exercise are well known and documented. And even the loss of solitary exercise, the endorphins, etc., that can be gained from that can be tough for children and adults alike, frankly. So the goal today is to sort of talk about the role of warm-up, opportunities for strengthening and conditioning at home, and then to slowly discuss a little bit about how we'll return back to activities and how to do so safely. And so In our homes, there are safe ways to exercise while we are confined. In the case with outdoor activity, a good warm-up is still key at home. Children are not little adults, and so their bones and their bodies do not behave like little adults either. And so it's really important to remember that stretching not only helps them warm up and be limber during activity, but it's very crucial to preventing injury. The exact warm-up that you want to perform depends on the activities that you intend to participate in. For example, if you are a running athlete, lower extremity exercises are going to be the primary mainstay for a warm-up. And this can include a slow jog, stretching of the Achilles, which are the calf muscles tendon that connects to the heel, the hamstrings, which are on the back of the thigh, the quadriceps, which are on the front of the thigh, the hip flexors and adductors, which are on the inner side of the upper thigh. And by stretching those muscle groups, as well as the external rotators, which you can do, which are on the outer sides of the thighs, upper thighs, will enable your child to have adequate muscle working length. So the muscles have a tendency to sort of get comfortable where they are. And in children, where they are is not a static thing the way it is for us as adults. So they're growing and their bones are lengthening. And in the process, the muscles can sometimes get tight and not want to have the sort of plasticity that they need for kids to run, jump, and play without discomfort. The other thing that kids have that is unique is they have growth plates because they're still growing. So the cartilage in the bone, which is like a little layer, a little sliver of growth plate cartilage, is where the growth occurs. And so if you have a tight muscle and it's attaching at one of these sort of secondary growth plates, which are called apophyses, you can end up with an itis or an inflammation or an apophysitis. That's a frequent sort of constellation of injuries that can happen in kiddos. There's different names for them because doctors really love to name things after ourselves. So Dr. Osgood and Dr. Schlatter have one that's known at the front of the knee, the Osgood-Schlatter. Dr. Seaver has one, Seaver's disease, which is at the heel. There's a variety of these. There's also apophysitis that can happen in the pelvis. And so a good warm-up is really crucial to avoiding one of those types of injuries. Additionally, if you are a pitcher or a throwing athlete, then you want to consider stretching the upper extremities very diligently, working on the various muscle groups about the shoulder, the triceps, the bicep, and making sure that when we start pitching, you start with some low intensity lob type throws. And then after the arm feels, significantly warmed up, then you can move on to throwing with more intensity. Emphasis on all of this sort of warm up really prevents injury down the line. So when we go back to sports and we're dying to participate, the worst thing that could happen is if you have a season-ending injury. And the way to help prevent that is with a good warm up, with adequate stretching, and making that part of your child's routine for sport. As far as strengthening and conditioning goes inside the house, this is a challenge. As you can see, I am in my own home. And so we have been trying to do various activities. I have a toddler and an infant, so it's a little bit limited. But in a little bit older children, there's a lot of things that you can have them do depending on their developmental state. And so once you are working on conditioning, the things you want to keep in mind are that conditioning can be a family activity. It can be something that is social within your accepted social group, and it can really work on maintaining at least a baseline level of activity and ability that you can build upon when we can go back to working out and playing sports outside. So depending on the age of your child, you can use several different exercises and build a circuit that you guys can do together. The integration of both sort of what we call isometric or static, holding in one position exercises, things like planks and side planks, in using those in conjunction with more dynamic activities, things like burpees, star jumps, which are really fun for littler kids, side jacks, that's when you do a jumping jack and you go into a lunge as you do it. These kinds of activities can be really great. Mountain climbers are another example of a great dynamic activity that works on your cardiovascular system as well as working on strength training. Push-ups are also great. Keep in mind, until your child is close to adulthood, sort of well into adolescence, weightlifting is not a great strength training regimen for kids. They cannot build muscle until they're making their adult hormones. And so there's not a huge benefit to anything beyond body weight training. Additionally, that protects the growth plates if you stick with body weight training, because an excess load can be placed or a really large sort of pull can be placed with weightlifting. And if we're not doing it in an environment where the people who are coaching are really trained in coaching, you can have some pain and other issues for the kiddo. So last thing that I'd like to discuss is going back to normal activity. I think that as we go back to normal activities, hopefully with this strengthening and conditioning exercises, you'll be ready. But you have to remind your child that they're going to be at 60% of their normal. They're not going to be at 100% because they haven't been doing their activities regularly. So as much as you can possibly remind them before they start so they don't get discouraged, so they set a very reasonable expectation for themselves and are motivated to move forward, I think that our kids can get through this period still strong, still conditioned, and ready to get back to life. So take care, everyone. Stay safe, and thank you for listening.
Hi, my name is Dr. Alexis Colvin. I'm an orthopedic surgeon at Mount Sinai, as well as the team physician for the U.S. Fed Cup team and the chief medical officer for the U.S. Open Tennis Championships. I've also served as a sports medicine physician at the U.S. Olympic Training Center in Colorado Springs, Colorado. As parents, we are used to wearing many hats, and certainly the role as healthcare providers for our children is one of them. The goal of this presentation is to give you high-yield information to be able to know when to see a doctor and when to try to monitor your kid's injury at home. I'm going to focus on the knee and ankle as those are the most commonly injured areas with activity in kids. Accidents will happen, and children and adolescents have differences from adults and make them more susceptible to certain types of injuries. Kids have growth plates, also known as physes, which are the weakest part of the growing skeleton and are more susceptible to injury than ligaments and tendons. These growth plates close at different times depending on age and gender. Boys' growth plates fuse later than girls, so they make up a higher proportion of growth plate injuries. In the left picture, the pink arrow is pointing to the top part of the knee, also known as the distal femur, which fuses in girls around ages 14 to 16 and in boys between ages 16 and 18. The blue arrow is pointing to the bottom part of the knee, also known as the proximal tibia, which fuses in girls around age 13 to 15 and boys 15 to 19. The image on the right is demonstrating a knee in which the growth plates are closed and with the various ligaments and their location. On this side, the main ankle growth plate, also known as the distal tibia physis, fuses in girls around age 14 and in boys around age 16. Once these growth plates are closed, the picture on the right shows the location of the ankle ligaments that now become more likely to be injured. Whether or not a child's growth plates are still open is important, since a condition that typically results in tendinitis in an adult, such as Achilles tendinitis that affects the back of the heel, in a child is actually a growth plate problem at the heel if that child is between the ages of 18 and 14, because the growth plate is actually the site of the irritation. Similarly, in the knee, if you look at the picture on the right, an overuse injury that can lead to patellar tendinitis in an adult in kids will be seen either as the syndrome number 1 or the disease number 2, depending on which growth plate is being irritated. In a more extreme case, an injury that would be a ligament sprain in an adult, such as in the ankle, could actually result in a growth plate fracture if a kid's growth plates has not fused yet. So, when to bring your child or teenager to the doctor? Number 1, any significant trauma that leads to deformity or significant swelling. Number 2, if there's broken skin or excessive bleeding. Number 3, difficulty bearing any weight because of pain weakness, or feeling unstable. Number 4, if your child's unable to lift his or her leg up or wiggle their toes due to significant pain. Number 5, a child that does not have full motion, or the knee or ankle is stuck in a certain position and the child's unable to move it out of that position. Number 6, discomfort that is not improving with medication, or medication that cannot be weaned because the child continues to be in pain. And number 7, any change in color, for instance, the discoloration of the foot or the foot turning blue. So what can be done at home? The simple rest, ice, and compression is an easy thing to do at home. Tylenol or any anti-inflammatory such as Advil or Motrin. And if there's any question, we are here with telemedicine appointments, both virtual and in person. Thank you.
So as we get to be more active now, and we have some ideas of how to get our kids exercising and doing things outside as the weather gets nicer, unfortunately that also means that there's a chance that they can get injured like any child. We know that when they're out in the playground or doing sports or other things, injuries can happen. And so as we're going through this pandemic, we'd like to try to give you some guidance as to when you can, or how you can assess things at home, and when perhaps you need to bring your child in to get checked, or when this is something that you might be able to manage on your own. And so there's some clues that we can give you when it comes to that. The first thing I would tell you that is, if your child says they've gotten hurt, if you weren't there watching it, let's say they were playing with their sibling or doing something outside, riding their bike, and they come in saying they got hurt and they've hurt their arm. I'm going to focus on the arm as a shoulder and elbow doctor. First thing you want to do is try to understand what happened. So ask your child how they got hurt. Did they fall from a height, maybe off the monkey bars or something like that in the playground if it's open? Did they fall down the stairs? Did they fall off their bike, off a skateboard, something like that? We tend to try to understand if an injury is what we call high energy, meaning that there was some force involved. So that's more typical of a biking accident, a skateboarding accident, a fall from a height. With those, there's more likelihood of a more significant injury like a fracture or a broken bone, or a more significant sprain that might require more treatment. If your child says that they feel like they pulled their muscle or they strained their arm doing something athletic, then that may be something that's not quite as severe, doesn't have as much energy, and often those things can be watched. And so it's important to try to understand how your child got hurt, how severe their pain is. Often when things happen and it's a fresh injury, it's going to be pretty severe, but things that aren't so bad will calm down pretty quickly. And so understanding the mechanism or how it happened can be helpful. Next thing is to try to take a look at your child's arm, and you really want to be aware or focus in on the area that's injured. So first thing, you want to look at the arm and see, is there any deformity? Is there any crookedness? Let's say they fell on their wrist. Is the wrist straight and looks flat, or does it look a little funny? Certainly if there's any deformity, that's concerning for a fracture or a dislocation. You want to look for bruising, and bruising might not happen right away, but if your child does develop a black and blue bruise around the zone of injury, that is, again, more concerning for something like a fracture, and probably does require it to get looked at. And then the other thing that happens with injuries is swelling, and that's pretty common, and that can happen with a strain or a sprain or a pull, but it can also happen with a fracture. And so swelling in and of itself or in isolation doesn't mean you have to rush to the emergency room, but it's, again, a sign of an injury to the area, and it's something that you want to look for. Then when my children have gotten hurt, the next thing I'll do is try to see if they can move the injured area on their own. So if the pain is not too bad and your child can bend their elbow or move their fingers or move their wrist, then it's unlikely there's a significant fracture or sprain or dislocation. Children tend to be smarter than adults in that when they get hurt, they don't try to force it or do something through a lot of pain. And so if your child is really unwilling to move their arm or move that part of the injured arm, then again, that's more likely to be a more significant injury that you might want to have it get checked. If you think this is something you can manage at home, then the next step is to try to help your child with their pain and do treatment at home. And really this falls into the category of the classic, what we call RICE treatment, R-I-C-E, for rest, ice, compression, and elevation. So if they've injured their wrist, have them rest it. You can put an ice pack on it. If you have an ace bandage or even an old t-shirt or something, you can do a compressive wrap to try to hold the ice in place, and then have them try to elevate it. That will help with swelling and that will help the pain. If you have access to a sling at home, you can use that if it's uncomfortable and the child doesn't want to move their arm. You can fashion a sling from a towel or an old t-shirt as well, just something to help hold and support the arm if that's a comfortable position. Obviously, if they're in pain, you can give them home medication, Advil or Tylenol or medicine like that at the appropriate dosing for your child's age and height and weight. And then if you're going to ice is very helpful for pain and for swelling, and we tend to use ice with acute injury as opposed to heat. Heat is generally used for things that are more chronic, maybe stiffness or other things. But with an acute injury, we're going to use ice, and we want to have the ice on the affected area for about 20 minutes so it's most effective. If you're going to have put ice on your child's arm, you want to have some cloth or something between the ice and the skin so it doesn't burn their skin. And again, you only leave it on for about 20 minutes, and you can do that a few times a day for the first few days to help minimize swelling and help with pain. And then when it comes down to when to come to the emergency room, really, I think it's if there's any deformity, things just don't look right to you. Obviously, that's a concerning sign that something has been broken or dislocated. If bruising does develop, I would recommend you get an x-ray because you could have even a hairline fracture that you want to get diagnosed so you don't have that shift or move. If the pain is not improving in 24 hours and you've done the ice and the Advil and it's still really uncomfortable, if your child won't move their arm, even if there's no deformity, then again, that may warrant something more acutely done to try to make sure there's no break with an x-ray or an evaluation. And then the bottom line is parents, you know your children the best, and if something just doesn't seem right and you're concerned, then you bring them in. And thankfully, as the pandemic has calmed down, we're getting back into taking care of our patients in the office, and so we're available to help you with this if your child needs it. So hopefully these thoughts have been helpful, and as I said before, I hope we all get through this together, and please be safe and healthy, and enjoy the warm weather, and get out and exercise. Take care.
Thanks for tuning into our webinar, Staying Safe in the Time of Shelter at Home. We hope we've been able to provide some useful information and tips that you can use in the coming weeks. Here is information on accessing our orthopedic physicians and surgeons. In the meantime, stay safe and stay healthy.